Today we'll be reviewing the direct impact of different individual therapies. Many have been used in the past, including psychodynamic therapy, aversion therapy, psychopharmacology, alone, solution-focused therapy, and the choice theory. Although research continues to be controversial, there are 4 endorsed methods which we're going to cover. They include motivational interviewing, cognitive behavioral therapy, mindfulness therapy, and psychopharmacology. Motivational interviewing focuses its efforts directly on the client, encouraging the individual to a self-chosen path of positive ideas and recovery, while rolling with any resistance. The flow is created by combining both the method and the spirit. A sequence of 4 processes is used to create the method. They proceed in the order of engaging the client, focusing on goals, evoking any arguments toward change, and finally creating a specific plan. The 4 spirits of motivational interviewing include complete acceptance and respect of the individual, compassion for the client's welfare, evocation of the client's perspective, and collaboration of the three, giving the individual a feeling of empowerment. The flow of combining the method and the spirit result in change talk. First, the individual starts with preparatory change talk, which usually includes the elements of desire, ability, reasons, and need. This leads to mobilizing change talk, which is the language of commitment and intent to change with minimal hesitation. Now the client is willing to give direction toward the goal. This type of therapy seems like it would be extremely productive and rewarding, allowing the client to discover their own path to personal growth. The only drawback may be perhaps that they live in an inconducive environment, so while they became motivated to change in therapy, they don't hold the skills to maintain their commitment and become easily influenced by outside forces. Cognitive behavioral therapy is the combination of both cognitive therapy and behavioral therapy, and considered a cost-effective treatment. It examines how an individual's thoughts and feelings are connected and influencing the individual's behavior. To move towards a change, the therapist first has the individual recount traumatic events that are connected to feelings as a result of everyday situations. Homework is also given to identify when these thoughts come up and working on changing these thoughts to a more positive outlook to release stress that may result in destructive behavior such as relapse. Some trauma is more deeply ingrained that it may take a more intense approach known as comprehensive and integrative psychotherapy. An example of this is eye movement desensitization and reprocessing therapy, or EMDR, which consists of 8 phases in order to discover, identify, and change trauma that resulted in PTSD. Personally, I was first skeptical about EMDR as if little buzzers in my hands were going to change feelings I had about the past. However, after experiencing it firsthand, I was actually amazed at what happened. Things that made me mad suddenly brought tears to my eyes, and I was able to forget and forgive through the sessions. It was a hard program to get into, however, because space was limited. I believe many people could benefit from this process, but what if they have too many experiences to even remember? Would they ever be able to really heal? And what about the cost? I don't believe it's free, and sometimes it's hard to let go of well-deserved grudges. The mindfulness technique aims to gain control over stress and undesirable feelings that could lead to impulsive behavior. Studies show that it is effective in reducing cravings on scales of acceptance, awareness, and a lack of judgmental feelings. It helps to regulate the thought process of compulsivity. A study was also done showing that mindfulness techniques were more effective than cognitive behavioral therapy in reducing the response to psychological and physiological stressors. This method seems great for people who have great attention spans and a lot of self-motivation. It really seems like it could help anybody with reducing cravings by self-awareness. However, it may not help individuals with deeper underlying issues enough to stop the impulsive behavior, or people that are struggling to quit when their withdrawals could harm them or others. Pharmacotherapy aids in detoxification and can increase the quality of therapy and assist in relapse prevention. Medications are prescribed, administered, and monitored to help individuals safely withdraw from a substance and aid in maintaining sobriety. There are many different medications directed at specific drugs of choice to aid individuals through the process. They are advised to attend individual therapy sessions. Some medications are also used to prevent or cause adverse effects when taking the drug of choice to help reduce cravings. I think this is helpful for people that don't have a lot of resources to wean themselves away from their substance abuse disorders. However, medication alone is not always enough to help the individual cope with society. I personally would love to learn more about the motivational interviewing technique because it allows the individual to come up with their own solutions, giving them more confidence and direction in their life. It seems like it would guide them to personal progress, increase self-awareness, just like mindfulness, and boost their self-esteem by simply asking questions and accepting them for who they are and where they're at.